All right, so we're here today with Deborah. Deborah is a patient of ours. It's been about 3 or 4 months, probably been 2 or 3 months actually now. Hasn't been that long. When did we start?
It was the end of May, wasn't it?
End of May.
Latter part of May.
Yep, that sounds about right. Her chief complaint when she came in was that she was having a hard time regulating her diabetes. She was taking a good amount of insulin every day, and she was still running on the high side. She also had some digestive problems, a lot of burning in the stomach and bloating and some other things. So tell us a little bit about what brought you in, what the problems were that you were having, and what you've seen so far as the results with our protocol.
Okay, well, when I first came in, I couldn't manage my diabetes. It didn't seem like I was taking more than 50 units of insulin every day. I was giving myself a shot 4 times a day, and still couldn't seem to get it down. My numbers would be up in 200, 300s.
Yep.
I never had any low hundreds back in those days, which now I'm proud to say I'm down around. I usually don't get above 120 so far.
Correct.
Which has been
a lot better.
A whole lot better. I had a lot of stomach issues, burning. Never could get rid of the heartburn's what I thought it was. I've been taking Prevacid for years, a daily dose of Prevacid, which I now know is bad for other things. But it was causing a lot of issues with my digestion, my intestinal problems and things like that. I stayed tired all the time. My feet felt like they were going numb. I didn't have a whole lot of feeling in my toes anymore. I'd get these real bad cramps where I would just have to stiffen my feet and leg until it went away, kind of a thing. My hands would feel like dead, especially in the mornings when I would get up, like maybe 2 or 3 fingers on each side.
So what you were having really was, because of the diabetes, you were having what's called peripheral neuropathy in both your hands and your feet. And you had some, your toenails weren't right there either,
No.
because it had been like that for a while. So
I even had the red rashy ring around my toes.
Right, I forgot about that.
Going up and down each sides of my toes.
That had been there for a long time that you could not get rid of, and you were using a cream on there that hadn't worked either.
Right, I even went to the podiatrist and got cream, and it still didn't work, and they wanted to itch.
So part of what we did with your protocol was not just about getting the blood sugar under control, but we did a peripheral neuropathy protocol with you as well for the problem that you were having in the hands and feet. So what's going on there?
Now it's all better. I can feel again. I don't have to hobble when I get up in the mornings. I haven't had cramps in more than 4 weeks. It's been
great.
No cramps. My fingers don't go dead anymore. This is really great. I can feel them again. It was so bad in the mornings I couldn't hold my hands up long enough to curl my hair to get ready for work. So now I can do that without having to sit down.
Good.
I can stand up now on 1 foot again. I had to sit down to put my hose on in the mornings. I was really tired, just no energy at all, and I was like, I'm only 55, am I going to be like this? This is like for old people kind of thing.
Right.
I was so tired. My hands, I couldn't put my necklace on anymore because my fingers didn't work right.
Right, you couldn't feel the pieces that you're working with.
Yeah.
And you can do that now.
I can do that now.
Great. So the peripheral neuropathy that you came in with is pretty much resolved at this point. The blood sugar we're still working on. Although you were taking a little over 50 units a day, you were giving yourself a shot 4 times a day, and now, of course, with the help of your doctor and with them monitoring you as well, you've been able to lower those doses to some days. I look at your sheet when you come in, and you've only taken maybe 5 units or 10 units or.
Right.
I think the most I've seen is 20 occasionally, and usually there's a reason for that you know about.
Right, and that's a total for the whole day, because I was doing that at one time, 20 units each.
Correct. Yeah, and that was 50 units of Novolog and then 25 of the Levemir. So we're down to like a total of, 5 to 15.
I don't do the Levemir anymore, and I'm either 5 or 10 units at a time in the day now.
And it's keeping you pretty regular.
Mess up or not.
Great. And we also were taking some other medicines for a couple different things. Talk about that.
When I came in, I was on a whole, I still take the Plavix and the lisinopril, because I did have a heart attack a year and a half ago, I guess. But I was taking things like Lipitor for cholesterol. They had Tylenol, which it was something heart related as well with that, which I don't take any of that anymore. I'm down to, I don't even remember them all.
Yeah, a
Took
whole lot
some
less.
in.
So the moral.
I feel like I don't take anything anymore compared
Yeah.
to when I came in.
Definitely a lot different. So the moral of the story is, really at 55, you'd already had a heart attack.
Right, and I always thought it was just from eating meat, but it was from the sugar.
It was from the sugar, but there were some infectious processes going on that created inflammation that increased your risk for cardiovascular disease. So part of what we were doing with you is to reduce the inflammation that we found in the body, and also to address some of those problems with infections that you had as well. So
being on the Plavix for my heartburn was killing all my good things, which was making my, I guess, infections and inflammations worse, unbeknownst to me.
Yeah.
I was just taking it.
Yeah. Well, isn't it amazing that you were taking that Prevacid all that time and still suffering horribly, and then as soon as you get things right and you adjust your diet accordingly and you start to eat more, what you're supposed to,
right, then
those things just go away. So really, I mean, that in and of itself has been huge for you, because you had a very big problem with the burning, even initially. So it took us a while to get that under control, but really what we found was that there was some things going on in the gut that shouldn't have been there, and also that there were foods that you couldn't eat that were a problem as well. And when we removed those things that were keeping the fire stoked in there, then we see all of these really great results. No more burning in the stomach, the peripheral neuropathy in your hands and feet resolved, the blood sugar very, very much better. We still have some work to do on that, and I think there's still some improvements that we can make. But it's been...
it's only been, 7 weeks?
It hasn't been that long, you're right. We still have another 2 months to work with you, and I think my goal for you, of course, is for you to be in the best health ever by the time we're done with you. So we'll check back in with you a little bit later, okay, and see what's going on then.
Looking forward to it.
Great. Thank you so much, Deb.